Hi, I'm Ken Spector with HappyCow, and I'm here at VegFest 2018 with Dr. Joel Kahn. And Dr. Joel Kahn is the owner of the Cardiac Longevity Center. Is that correct?
You nailed it.
Yes, he also is a best-selling author. He's also a lecturer, and I've seen him in a number of videos. He has a lot to talk about. Joel, pleasure to meet you.
Thank you very much.
Yes, so as far as cardiology and veganism, why should everyone become vegan?
Well, so many reasons, but as a cardiologist, the strongest data for any medical topic. People become vegan for health, people become vegan for the planet, people become vegan because they can't tolerate animals being abused. The strongest medical sector is heart disease. The strong data you can prevent, halt, and reverse heart disease is overwhelmingly scientific. I serve as a university professor, and I'm so lucky to be able to teach medical students about 70 or 80 years of data about the ability to change your diet, reverse plaque. Dr. Dean Ornish, Dr. Caldwell Esselstyn, Dr. Joel Furman, and yet in my clinic I see it all the time. I can actually document you're getting younger and younger. The more turnips, the more radishes, the more kale, the more carrots, the more apples, the more grapes you eat. It's really remarkable.
Now, have you done surgery on a vegan, a person who said he was or she was a vegan?
I don't see vegans that are coming for heart disease. I see vegans that are coming for a bit of adding to their nutritional profile with maybe a little bit of extra insight on fasting and vitamins. But no, I do not.
That's a really good sign. Now, you wrote a book called Vegan Sex. Was that your book?
It's out. Yes, it's true. I wrote it. I wrote with two incredible, wonderful co-authors.
Okay.
I wrote the medical part. Ellen Jeffy Jones wrote the female part, and Beverly Lynn Bennett wrote the recipes, amazing recipes. The bottom line is, in reality, it's nothing to be embarrassed about. We all know it's an important part of life, psychological health, physical health, and the data for heart disease and being able to maintain a healthy sexual life and performance. It's unbelievable. If anybody knew how powerful it was to have fulfilling and regular sex with a significant other, they would actually go at it like any prescription drug that was possibly out there. So it's a wonderful way to augment joy in life, health in life, and the data suggests actually longevity.
For women and for men?
Yeah, unfortunately we live in that world where 80-90% of the scientific data is in male subjects. It's just a few things are easier to measure, but nonetheless it works universally without a doubt.
What have you learned more recently, information that you've learned more recently about veganism that you feel is compelling or really interesting?
Well, in the medical world, it's what's happening with what are called autoimmune diseases. We're having this incredible and sad rise in arthritis, in connective tissue, in psoriasis, in thyroid, in multiple sclerosis, diseases where our body is attacking itself. It's a whole bunch of factors, but a lot of it is the food, and a lot of it is animal foods with antibiotics, with hormones, with very high concentrations of pesticides and roundups. And unfortunately, plants aren't totally immune from being contaminated, but they're much, much, much less. So we're finding rheumatoid arthritis, lupus, Sjogren's, the disease that Venus Williams had, where your glands become dry, and things like that can actually reverse. We thought it could reverse with using very powerful, expensive, dangerous medication. Now we're finding these diseases can reverse with green smoothies and kale salads and eating fruit for breakfast. Amazing stuff.
How long does it take if someone comes into your office and has some stents put in? How long does it take before perhaps you see a change after they've changed their diet to a vegan diet?
Yeah, so my real goal is to get them before the stent, even if they're really having trouble, angina pain, failed stress test. If they're having difficulties, I can measure. Within a month, I can measure improvements without the stent if they'll adapt to the diet I want them to adapt to. Whole food, plant-based, no added oil. That's the therapeutic diet, without a doubt. And you add in a lot of flax for all the omega-3. 3 to 4 weeks. Their amount of nitroglycerin, the amount of chest discomfort, the way their electrocardiogram looks, the way their stress test looks. 3 to 4 weeks is what it takes. Not very much, but you can't compromise it. Just totally jump into it, and you'll see the results in almost every case.
Terrific. You've been vegan how many years? 40 years?
40 plus, 41.
40 plus, 41 years. And what do your results look like? What is your cholesterol level, your LDLs? And
well, it's going to be my 100th birthday next week.
Nice.
No.
Perfect.
You can't guarantee people that they're going to have freedom from medication and perfect health on a planned diet. You can tell them it's like wearing a seatbelt and an airbag. You're going to maximize the chances of a smooth ride. I've had a very smooth ride, no medications. I wake up every day, have energy for 16-hour work days, and I'm very grateful for that, and I don't take it for granted. I totally attribute the diet for all those years to that. But it's a wonderful thing, and I am planning to be about a third of the way through life here at age 60, looking at a whole lot of years ahead of reaching out, helping, being productive, because the energy is so high on these plants.
Very cool. Now you have a restaurant, you have 2 restaurants now in the Detroit area,
right,
or in Michigan, and then you have a food truck down in Austin, Texas. Right. GreenSpace. Can you talk a little bit about the restaurant and the menu?
Yeah, so when you're really wonk like I am, you say, if I've done this for all these years for my body and 30 years for patients, I really ought to really put my money where my mouth is. So I opened a very large restaurant with my son and my wife called GreenSpace Cafe. Seats over 100. It's amazing. And that's in Detroit. I mean, it would play out here in Santa Monica or Venice. It's playing amazingly in Detroit for 2.5 years. We just opened a second kind of fast casual grab and go that's taken off like no other. And we have a food truck in Austin, Texas, only because the weather's so good and you need good weather for a food truck. So we're planning to have a lot of these because the medical input I can give and the team we've developed is just unbelievable. And the need is, pressing for people to do the right thing, make it easy.
I haven't tried the restaurant yet, but is the menu salt, oil, sugar free? Is it? What is the menu like?
We don't force it on you, but there's very clearly choices that we kind of give credit to Dr. Caldwell Esselstyn choices. Plant perfect, so you can go there easily and have everything as an option without oil that we make available. And then, if you don't want it that way, you can have it kind of the generic way too.
Okay, very, very cool. And you can check out Joel's restaurants on HappyCow. And thank you so much for the interview. I really appreciate it.
I'm really thrilled. This is the greatest website. I mean, all my patients have to know about this. It has made their life so much more successful in the plant world.
I'm so glad to hear that. Thank you so much, Dr. Kahn. I really appreciate it. I'm Ken Spector with HappyCow. We're at VegFest 2018. Take care. Bye-bye.